The treatment of the study is prompt therapy. The prompt system is a tactile, kinesthetic-based treatment method. The prompts are targeted to guide the client through the temporal and spatial aspects of speech movements. Prompt can be used to cue or prompt speech segments at the phoneme, word, or phrase level. Prompt therapy can benefit many individuals. It was originally designed to help children with developmental motor speech disorders, but has been modified to effectively help adults. Prompt therapy really interests me because you can use it in such a variety of ages and disorders to try and increase motor abilities. The study has shown me how beneficial it can be, and I think it can be useful in many future patients of mine. The primary purpose of this investigation was to determine the effectiveness of prompt treatment on improving precision and automaticity of speech movements under different linguistic demands. The secondary purpose was to determine if there are changes in linguistic accuracy without taking into account motor performance changes. The subject was a 30-year-old female who was diagnosed with severe Broca's aphasia and severe oral and verbal apraxia. She demonstrated the ability to formulate the sentence types used, but lacked the motor facility to support these productions. The study consisted of 30 short phrases grouped into 3 different types of sentences: imperatives, declaratives, and interrogatives. The subject attended individual treatment sessions 3 times a week. First, the target behaviors were base rated for all 3 types of sentences. Then prompt treatment was applied to the behaviors. After teaching the criterion, which was a maximum of 6 sessions, they stopped the therapy on that behavior and went on to the next type. They measured the percentage of precise and correct utterances. To be considered correct, the utterances were required to be free of articulation and fluency errors. The results showed that only once treatment was introduced with the behavior did the behavior improve, while the untreated baselines remained unchanged. Because of this, they were able to attribute the improvements to the treatment. All the sessions were recorded on a camera that was focused perpendicular to the subject's face in order to capture a clear and sharp picture of her speech movements. The movements were scored by 2 trained listeners who were speech pathologists. The results indicated that prompt therapy led to improved speech precision and sequencing of speech movements for trained and untrained sentences for imperative and declarative forms only. Contrary to their expectations, there was no large improvement for the interrogative sentences. The study did not address grammatical errors, but we still saw grammatical improvements, which shows us that not only do linguistic processes affect the motor system, but that the motor system, in return, affects linguistic formulation. I think a strength of the study is how much effort they put in to make sure that there was proper baseline data to base the results off of. Another strength would be how extremely motivated and willing the patient was. She welcomed the speech motor assistance given to her in the form of prompt cues. In addition, she showed no aversion reactions to the prompt cues. This increases the likelihood of her positive results. I also think a strength was that they used inner observers to make sure that the results were more accurate, which means that the experimenter and the observer have to have the same judgments for 30% of the responses. However, I do think that the study was very limited. We only looked at one subject, which makes the study very narrow and does not show widespread results that could be applicable across areas. The subject was a female, so we don't know if it could be different for males, and they only looked at one age group. The treatment worked on the imperative and declarative sentences because they are simpler forms. Prompt treatment is most effective and beneficial when linguistic demands on the individual are reduced. It did not work as well on interrogative behaviors because the interrogatives are more complex forms of sentences for individuals with Broca's aphasia to produce. Prompt cues do not work as well on more demanding actions. I would be curious to know if they did therapy for more than 6 sessions on the interrogative sentences if they would show improvement with further therapy. I would like to know what future research on less motivated subjects or those who have difficulty tolerating the prompt cues would show. I think this study is a great baseline study, but a lot further research needs to be done to be able to generalize the study across multiple areas. They should repeat the study with more diverse and larger number of subjects, and they should also try to do therapy sessions for more than just 6 sessions on the interrogatives.